Personal Best Pilates Instructor Academy presents Continuing Education Online Courses. Hello, my name's Amanda, and I will be your instructor for this course. I've been teaching fitness and exercise science courses to the public and in an academic setting since 1987. I hold a bachelor's in exercise science and a master's in higher education with an emphasis in exercise physiology. Prior to starting Personal Best Pilates Instructor Academy, I was a full-time faculty member in the Physical Education Department of Santa Fe Community College in Santa Fe, New Mexico. Because of my experience teaching college, I created PIA's courses in a flexible college curriculum format. Being a fully certified Pilates instructor is not something you can achieve with a single weekend workshop or by watching a video. Our Pilates instructor education is a very challenging process and requires a sincere commitment on the part of the student. But if a student is committed to the process, I believe it is my responsibility to provide the most supportive learning environment possible. I personally mentor each student through the entire process and enjoy watching them grow as instructors. Our courses have been recognized for continuing education credits for the Pilates Method Alliance, the American Council on Exercise, the Aerobics and Fitness Association of America, and the National Strength and Conditioning Association. My philosophy towards Pilates instructor training is simple: to provide high-quality exercise science-based education that is affordable, convenient, and most of all, taught in a supportive and inclusive environment. I hold these professional certifications. This is what people have to say about us. And here's a sample from one of our webinars. Healthy core and pelvic floor: how to integrate a pelvic floor focus into Pilates exercises. The gluteus maximus on the back of the rear, and then under that, the 6 deep rotators. I'd like to pay particular attention to the obturator internus, which plays a particularly important role due to its proximal attachment on the inside of the pelvis. The takeaway is that movement issues at the hip, i.e. rotation, can lead to or be because of pelvic floor issues. The transverse abdominis is an important muscle working with the pelvic floor. When the transversus abdominis tightens, the pelvic floor should rise and engage, closing the fire hose at the bottom. Now that we have reviewed the anatomy of the pelvic floor and discussed the connection between the core and the pelvic floor, let's talk about pelvic floor dysfunction. Pelvic floor dysfunction refers to a group of clinical conditions that includes urinary and anal incontinence, pelvic organ prolapse, sensory and emptying disorders, feeling like you have to go but can't, or not knowing soon enough that you need to go, sexual dysfunctions, and chronic pain syndromes. From a supine position with legs extended, have your client lift one leg about 8 inches off the floor. Then repeat on the other side. You are watching for tilting, twisting, holding the breath, or bearing down or doming the abdominals. Your client should be able to lift one leg and then the other easily without strain. We're going to start in a simple psoas stretch. In a kneeling psoas stretch, find the position that's comfortable to maintain and move through lumbar sagittal plane motion. This is just a pelvic tilt. Then move through thoracic sagittal plane motion, forward flexion of the spine, maintaining the same psoas stretch throughout the motion of the spine. Then moving to the frontal plane, the lumbar motion is a side-to-side swish of the hips. And then the thoracic frontal plane is a side-to-side bend from the waist. Incorporating a pelvic floor focus into Pilates exercises is pretty simple. Pilates exercises actually lend themselves very well towards strengthening the pelvic floor. However, just a few easy cues can increase your client's awareness and benefit. For example, footwork on the reformer mimics the squat matrix.